There are many different terms that physicians and healthcare professionals use for breaks in the skin. It can range from scratch to puncture to defect. In the medical profession, there is a tendency to group all of these together, and the most common term when we're talking about difficult to heal wounds would be the word ulcer. A venous ulcer, in simplest terms, is a break in the skin that occurs because of poor venous return. We understand that the arteries bring fresh blood down and that the veins bring the used up blood from the cells back up to the heart to be refreshed and cleansed. When there are problems with the return of this venous blood, it can become stagnant. It can flow in a backward fashion, meaning that these waste products don't get out of the leg, and the buildup of these can cause swelling, discoloration, and ultimately lead to a venous ulcer. A pressure ulcer, also called a decubitus, also known as a bed sore, is a type of skin injury, also affecting the deeper tissues, that occurs when there is unrelieved pressure on the tissues. Most commonly, these occur over bony prominences, such as the heels, the tailbone, the buttocks, and the back of the shoulders. A diabetic ulcer is an ulcer caused by a change in the sensation of the nerves of the foot. There are three basic types of nerves. There are motor nerves, which affect how things move, sensory nerves, which affect what we feel in our sensation, and the third type is called autonomic, which affects sweating, secretion of oil, erection of the hair follicles in our skin. When you have neuropathy, meaning the diabetes has affected the nerve function, any of those three types of nerves can have problems, and in the case of a motor nerve, it can result in reduced or changed function of the muscles. For a sensory nerve, it can result in what we call neuropathy, meaning loss of or reduction in sensation. This means that the patient can walk on stones, rocks, or other objects without knowing that they're having any problem. A problem with the autonomic nerve means that the skin turgor, skin texture, is altered, usually for the worse, and this means the skin is much more susceptible to injury, especially in conjunction with the other two types of nerve injuries.